question. It's related to health care. You get 1 minute apiece to respond to this one. Tennessee is the second most obese state in the United States. No, physical education requirements have been cut to minimal levels in middle and high schools, and many communities have become food desserts with no fresh fruit or vegetables available for miles, like our table back here. Thousands of citizens are deserts. Thousands of citizens are uninsured and receive no health care. In Tennessee, 8.3 of every 1,000 babies die before their first birthday. That's over 700 babies. In Memphis, 20 out of every 1,000 African American babies die. This infant mortality rate is a direct result of lack of health care. Some people have to choose between paying the electric bill or buying their medicine. Without health care, just one catastrophic accident or critical illness can bankrupt the entire family. And collectively, what steps will you take to ensure the good health of all of Tennessee citizens and ensure that we will have access to quality, affordable health care? Mr. Hagar?
It's another really big issue to me, healthcare. A lot of the family work in healthcare. I want to say one thing is that as a community and as a part, I want to support, one of the main things I want to support is play programs here in this community and this communities all throughout the state, like the NFL 60, the Play Cities. They get kids to get out and play. I coached football for 14 years. Kids need to get out and play. Very important that they do this. Very important that they understand. You got me on 30 seconds. Very important that they understand taking care of themselves and their bodies, and it's taught by the community and how I have a lot of plans for that. We have how we can do that. Healthcare issues. Number one, we need to get. If we're going to work on getting jobs, we got to work on getting good jobs where employers provide. I don't know what the federal government. If anybody understands what the federal government can put down yet, I have yet to understand the system, and I will look hard at that system. And I'll work hard, and if it's a good system, we'll take it. But if it's not a good system, I won't take it.
Healthcare is important to every single one of us. I think it has a lot to do with us perhaps changing some of our habits. Specifically, I'm very proud of the Greenway, the walking trails we have along the river these days. I know most of our neighborhoods have walking areas. I think sidewalks are important. To be more specific, I think the Donaldson area needs to receive some state funding so we can turn that into more of a pedestrian zone. We need to flip that economy down there and get business thriving. And we need to create an environment that allows us to perhaps be more active and maybe leave the car sit and rest a little bit. I apologize if that seems broadly vague. Again, I don't have things specifically in front of me. I will study every issue. I take it very, very serious. I am an employee of a healthcare company. I worked in healthcare for most of my life as an IT professional. It's very important. We've got to, once again, it gets back to our budget issues. I think we need to be able to fund it. And I think the real answer to funding better healthcare is more jobs. Jobs, jobs, jobs.
Wait a minute. I think the real issue for me when it comes to healthcare is wellness activities. I mean, that's our focus. We need to start with our youth. We need to get away from watching TV and a video game while you're snacking. We need to be out exercising with our children, focusing on wellness. Because my concern is if we get to the point where we're going to have to start funding more and more healthcare, where's that money going to come from? We're already out of this world and skyrocketing costs that none of us can afford. I certainly have struggles doing it. And the focus is we've got to start putting these wellness programs back in with these children, focusing on these adults, pushing their children to be active, to get away from these obese issues.
Thank you. No question about it. I think healthcare is very important. I think it starts at home. The parents have to be responsible for the nutritious meal that they provide. Then they take off to the school. We have to do a better job of creating recipes for children to follow on a daily basis with exercise, with the mental discipline. Now, as it relates to healthcare, the major healthcare, there's no question about it that when that bill gets to Tennessee, we need to take a good look at it. We need to use use what we can use and amend those parts out of it that doesn't work for us. There's no question, I think we have to provide health care, but it's the way we go about doing it. I will assure you that we will look at every aspect of a health care bill sent to Tennessee, make sure it's responsible, make sure we're not taking care of people who we're not supposed to.
Thank you. Councilman Coleman got two of my points. It starts at home, and I don't know how you fix that. It continues on to the school, and it's not just education in the school. If you've been in the school lunchroom lately and seen what they serve, we need to get back to nutritious meals at school. When I was in public schools here, you couldn't buy Cokes, you bought juice or water or milk, and so we need to take care of that. As far as the healthcare issue itself, I can tell you what the answer is not, and the answer is not government-run healthcare. Absolutely, in no way is that going to fix this problem. And this may be a little controversial, but I'm going to go ahead and say it. I think one of the issues that we have in this country with healthcare is our expectations have far exceeded our capacity to fulfill them. And I think we need to get our folks to understand that they don't have to run to the emergency room or the doctor every time they scratch their finger. I think that will do as much as anything to get them under control. Thank you.
Thank you.